Welcome back to Nurse Ed Scholar. So today I'm going to start a new series called Dosage Calculations Made Simple for Nursing Students. Um, you know, I want you to know that dosage calculations is not just about math. I know a lot of times students feel, oh my goodness, it's about math. Many programs have what's called a medication proficiency exam. Some schools say that they have to score a 90% to move on to clinical. Some say 100. Some schools give one chance. Some schools give two to three chances. I haven't heard a school give more than three chances for a medication proficiency exam. But I guess what I'm trying to say is that it's all about patient safety. So in this series, I'm going to help you kind of understand not only kind of how to calculate, but how you're going to think in nursing practice before you give the medication. Okay. You know, one thing I want you to know is that most students aren't really bad at math. You know, they simply just never was taught how to think through medication steps, because that really matters. Dosage calculation is not just about passing an exam. It's about patient safety. We want to know as nurse educators, can you calculate medications correctly? Can you prevent medication errors? Um, because you have to know if certain medicines cause toxicity, which can lead to cardiac difficulties, which could lead to death. So it's just, helping you understand that calculating medications is very, very important. And we really stress it. Some schools, if you can't pass the medication proficiency exam, you have to sit out to the next semester. Because, and the reason why we stress so much on it is because one decimal point in the wrong place can kill your patient. And so that's why we say medication safety is more than just calculations. It's about patient safety, because what you do can kill a patient. So in this video, I'm going to teach you dosage calculations in a way that makes sense. We're going to kind of break down basic dosage formulas, dimensional analysis, the basics, how to avoid some common mistakes, how to think through, like, before I give this medication, I just have something quick on that, because you need to know the calculations, but you need to know what to do before giving it. And what I mean is that if you can calculate, that's great. But if you give a medication at the wrong time, it could be detrimental for your patient. So in this series, we're going to go over tablets, how many tablets or how many capsules to give. I'm going to go over liquid medications, you know, um, calculating for IV push medicines or IV piggybacks. Um, we're going to go over insulin and heparin, um, even some weight-based medications. So I'm going to try to do like from basic to difficult. And so that's what this series will be about, hopefully breaking everything down for you so you will be prepared for your medication proficiency exam, and really just prepared for nursing in general. Okay. So let's start building this in the right way. Now, before you even start calculating, right, you need to understand why calculations matter. And I kind of talked about it, a few minutes ago. Every medication order has three questions they're asking. What did the provider order? What did they actually order? What medication do you have? Just because the doctor may order a dose, you may not have it in that dose. So that's where calculations are very important. And how much should you give safely? One thing is giving a medicine, but you're giving it safely. So how much should you give safely? As nurses, healthcare professionals, we don't blindly give medicines. We have to calculate. We have to verify. We have to think critically, you know, because giving too much medicine, like I said, can cause toxicity. And giving too little medication may not treat the condition. If you give too little of an antibiotic, it's not going to kill all the bacteria. If you give too little of pain medicine, patient's pain isn't going to be relieved, right? You know, every calculation affects your patient in some way, shape, or form. I guess that's what that means. I guess that's what I'm trying to say. Too much insulin can cause severe hypoglycemia, right? Too much morphine can cause respiratory depression. It will suppress your breathing. Too much potassium can stop the heart from beating. This is why dosage calculations are so important. They are a patient safety skill. That's why I said, you have those medication proficiency exams, right? Well, if you don't pass them, you can't move on in the semester because this is a patient safety skill. And that's what the NCLEX tests you on, right? Safety. So let's start out with a basic formula in dosage calculations, okay? So it's always the dose ordered, then divided by the dose available. And then you're going to multiply that by the quantity, like 1 tablet or 1 milliliter. And then that's going to give you how much to give, okay? So let's kind of translate that again. The provider tells you what your patient needs, okay? The medication label tells you what you have. And your job as the nurse is to figure out how much to give. And that's really what we're doing here. So let's break that down. Let's break it down one more time. You have the ordered dose is what the patient needs. That's what the provider has written for the patient to correct whatever the problem is. The available dose is what it is in 1 tablet, 1 capsule, 1 milliliter. Okay. And then the quantity is usually, like I said, 1 tablet. It could be in 1 milliliter, it could be in 5 milliliters. Okay. And then the final thing is that how much do I give? This will be your final answer. All right. So let's go on to do like the first the first example. And when you look at this, you may say, hey, this is pretty basic. And that's what we're doing. We're going from basic to challenging. Okay. So you have an order for metoprolol, and they're used as a beta blocker. So they use that for cardiac patients, 50 milligrams by mouth. But all you have available is metoprolol 25 milligrams tablets. So first you need to ask yourself, well, how much do I need to give this patient? How much does the patient need? The patient needs 50, right? 50 milligrams, you know, but you only have 25. So how much is available? Like I said, is 25 in 1 tablet. So let's plug it into the formula that we just looked at. You have 50 milligrams is what the provider ordered. Then you're going to divide that by the 25 milligrams is what you have available. And then you're going to times that by tablet. So you're going to go 1 tablet. And when you divide 50 by 25, multiply by 1, then it's going to give you 2 tablets. Okay. So the formula is going to be 50 milligrams divided by 25 milligrams times 1 tablet because you need to determine how many tablets to give. And Um, one thing that I want you to realize when you're looking at this formula, the milligrams cross each other out. You have 50 milligrams in the numerator and you have 25 milligrams in the denominator. And then you have times 1 tablet. Well, the milligrams cross themselves out. So your answer should be in tablets, which is 2 tablets. Okay. And when that happens, when everything is able to cross each other out, that's how your problem is set up correctly. And this is one reason why, we really try to teach dimensional analysis because it's kind of a checks and balances. Everything in the numerator, it matches the denominator and they'll cross themselves out. And the only thing that should be left is what you're looking for. So, what actually is dimensional analysis, right? You know, it allows the units to cancel. Um, so you'll have the desired unit left, right? What I just kind of explained. Students kind of like dimensional analysis because it kind of reduces memorization. It prevents mistakes because you're canceling things out, and it works on a lot of different types of calculations. You know, I guess when you're thinking about all that, you're like, man, dimensional analysis really sounds complicated, but it's actually one of the safest ways to calculate drug medications. Well, drugs. Drug calculations, right? And it's simply setting up the problem so the unwanted units will cancel out. So you will end up with what you're planning to give the patient. Okay. And so I guess let me show you how this works. So we've done one, and that was kind of simple with the metoprolol. So let's move on to another one. Let's do one with some liquid medication. All right. So the provider ordered 50 milligrams of a liquid medication, right? But the only thing that you have available is 250 per 5 milliliters. And you're like, okay, what am I solving? So remember, you need to figure out how many milliliters to give your patient of this medication. So let's just say this is Tylenol, okay? Because Tylenol, or I'm sorry, acetaminophen can come in liquid form. And so you're solving for the milliliters. How much liquid milliliters should I give my patient? And so that's what you want to end with. So you're going to take 500 milligrams, that's in your numerator, okay? And you're going to put 250 in your denominator, right? And then you're going to times that by 10 milliliters. Okay. So you're setting it up where you have 500 milligrams. Well, I mean, it's the same thing, but from what I just said, but you have 500 milligrams in the numerator. You have 250 milligrams in the denominator. And then you're going to multiply that by 5 milliliters. Okay. Now remember, the milligrams cross each other out, and you'll be left with the milliliters. So 500 milligrams divided by 250 milligrams, those cross out, and that should be 2, right? And then 2 times 5 milliliters should give you 10 milliliters. So you're going to give your patient 10 milliliters for a 500 milligram dose. Hopefully that helps. Okay, I hope. Let's keep going. Um, Students struggle with this. One of the major reasons why students kind of struggle with this, with dosage calculations, is because they try to memorize without really understanding the logic of what they're doing. They forget conversions a lot of the times. They ignore the units, but you need them to cross them out to cancel them out. And sometimes they misread medication labels. So I want you to not memorize, okay? Understand what you're doing when you perform the dimensional analysis to try to figure out the dosage calculation, right? I want you to ask yourself, what am I solving for? What is ordered? What is available? What do we have? Because a lot of times it will not be the doctor ordered 500 and the hospital is going to have 500. That would be wonderful, but it does not happen all the time. Okay. And then, okay, so I have what's ordered, I have what's available. What am I solving for? Right? Tablet, milliliter, and which units should cancel out. If the units don't cancel correctly when you're doing your dimensional analysis, stop because it's set up wrong. Okay? Something's wrong. Whatever in the numerator, something similar to that should be in the denominator so they can cross out so you can receive what you're actually giving to the patient. What are you solving for? What are you planning on giving? Milliliters, tablets, capsules. If it doesn't set up right and you haven't crossed out or canceled, something's wrong with your setup. Okay, so these are the common units that you will see in the hospital setting or the clinic setting. You gotta know, mg is milligrams, g is gram, mcg is microgram, ml is milliliter, and when you see units, you'll see that in insulin doses and in heparin doses. And a lot of the times, errors happen because students mix them up. Okay. And when you mix them up, You can really cause some serious medication errors. You know, we talk about memorization and we say, don't try to memorize, try to understand what you're doing. You know, and when we're saying that, we're just saying, really just don't rely totally on memorization. You have to know certain things. You're going to have to put it in your brain, but you just can't go all the way off of memorization. You have to understand why you're doing certain things and why you're figuring out things a certain way. So in one part, yes, you are memorizing, but in the other piece, it's you're really trying to understand so you can apply what you've learned. And it comes to this, when you're looking at medication conversions, students have to memorize the conversions because they're constantly used in clinical practice. 1 gram is not the same thing as 1 milligram. Okay, 1 gram actually equals 1,000 milligrams. So you have to know that a gram is larger than a milligram. And 1 milligram is not the same as 1 microgram. For every 1 milligram, there is 1,000 micrograms. So it's like gram is the biggest, then milligrams, then micrograms. Okay. And that is why conversions are so critical in nursing. If you give someone 1 gram, but they were supposed to get 1 microgram, you can imagine that is a catastrophic medication error. Okay. So let's look at conversions, some dosage calculation with unit conversions. So the provider ordered 1 gram tablet, and all you have available is 250 milligram tablets. So the first thing you do is you realize, okay, the units don't match. I got 1 gram here and I have 250 milligrams available, right? The provider ordered grams. The medication is available in milligrams. So what you're going to have to do is convert first. We know that 1 gram equals 1,000 milligrams. Okay. So now the order becomes milligrams. So you have 1,000 milligrams divided by 250 milligrams, okay, times 1 tablet. So you have the 1,000 milligrams in the numerator, 250 milligrams in the denominator. Those units cross out times 1 tablet. And that's what you're looking for. How many tablets I'm going to give this patient? And the answer is 4. Now, some common mistakes that students, nurses make. Um, they don't read the medication label correctly. They may confuse the ordered dose by what's available, by the quantity. Um, they may just forget the conversion. So you can always have a little cheat sheet with you. Grams versus milligrams, and like I said, that's a huge NCLEX safety point. Okay, so you really have to know the conversions. Decimals. We talked about decimals earlier. Another mistake is you you have incorrect. The decimals are in the incorrect spot. So when we talk about decimals, when you hear your instructor say, never add a trailing zero. If you have 5.0 milligrams, you don't want the zero after the decimal because that can actually make somebody think they don't read correctly or they're tired or they're going to think that's 50. Okay. You want to lead with a zero before the decimal point. So zero point 0.5 is wrong. You want to put 0.5. And the reason why you want to do that is because you don't want somebody to not see that decimal and think you're giving 5. Point 0.5, I'm sorry. Point 0.5. So it's like, you know, I'm sorry, I meant 5. I said point 0.5, but I really mean 5. So if you have the zero behind the decimal point, and the person doesn't see the decimal, they may think that the order is asking for 50, right? So if you don't put the zero before the point 0.5, if the person doesn't see the decimal, they'll think they're giving 5. Okay. I wanted to clear that up. I want you to see why that's so important, because you need to ask yourself, does the answer make sense, right? Because medication errors can kill your patient. And so before I move on, I want to say, as you begin nursing, there are going to be common medications that you're going to see, and you're going to see the dosage. So you're going to say to yourself, okay, well, I usually see 250 milligrams of this medication, right? And that's usually 4 tablets. Um, go with me here, what I'm trying to say. And if you calculate and you're getting 40 tablets, think to yourself, does anyone give 40 tablets? Nothing. Sometimes patients get like a prednisone taper, but it's like 4 tablets for a couple of days, 3, 2, 1. But they never really get like 10 tablets every day all the time. So that's why we say you really have to think critically. Oh, well, here I go. Let's talk about thinking critically. You know, real nurses ask, does this answer make sense? For example, if your I just said something like this. Oh my goodness. If your calculation says 15 tablets, you got to say, is this too much medication? And you should stop. Because how many people actually get 15 tablets? It may be one, it may be two, it may be 4 or 5, but 15, you're really going to have to look at that. If your insulin dose is extremely high, let's just say, you're calculating and the patient's getting, I'm going to be extreme, 100 units of insulin, right? Is this safe? Do you normally see 100 units? I mean, not typically, right? So you got to stop and you have to verify the order. Nurses don't just blindly trust calculations. You have to see if it makes sense. Should I verify this? Because if the calculation is like, is this really right? Because what happens is that the doctors will give the order, and then the pharmacist will do their calculations and give you the medication, right? Then when you get it, you should say, wait a minute, let me calculate this. If something looks wrong, and then you have to verify, because people make mistakes. We are all human, and we are the last people that's going to touch the patient. And we want to make sure that we give them the correct medication. Okay. So let's look at really quick, really basic, a little case study. You have a patient and they're in, their post-op, and they're in severe pain. Okay. And the provider orders 2 milligrams of morphine IV. And what you have available is 4 milligrams per milliliter. So you're going to take the 2 milligrams, that's what's ordered, and you're going to divide it by the 4 milligrams that you have available. And then you're going to multiply that by 1 milliliter, because that's what you want. What do I give this patient? And understand, remember, the numerator and denominator, those milligrams are going to cancel themselves out. And then all that's going to be left is that number times 1 milliliter, and that's going to tell you how much to give. So you're going to have 2 milligrams divided by 4 milligrams times 1 milliliter, and your final answer would be 0.5 milliliters. Hopefully that's starting to make sense. So with this one, you're like, patients post-op, they're complaining of pain. Morphine can mess with can really create some havoc. It can mess with them neurologically. It can affect respirations. So before your patient is in pain, but before you give, you really want to assess what's their respiratory rate, what's their oxygen sat, what's their blood pressure, all right, what's their level of consciousness, and what is their pain level. um because you really want to make sure that if anything is critically off or low, on your assessment, you may just have to hold that medicine because morphine can suppress the central nervous system. It can suppress respirations. So if your patient, they may be in pain, but if they're already breathing at eight breaths per minute, and you give them morphine, it's going to suppress it. Then your patient's not going to be breathing at all. The oxygen saturation is going to drop. You're going to have problems. If your person already has a poor level of consciousness and you give them morphine, that may sedate them too much. So you really are going to have to assess your patient on a regular basis. And always, when you give something, you go back to reassess. You don't wait too long. You go back and reassess your patient to see how they're handling that medication that you've given. And let's see, we're almost close to the end. So, when we're thinking about dosage calculations, you're really going to have to think of multiple things. You're going to have to understand the formula. You're going to have to, when I'm doing that dimensional analysis, trying to perform that dosage calculation, are those units canceling correctly? Did I convert my units correctly, right? Make sure the decimals are where they're supposed to be and use clinical judgment. You're saying, okay, does this answer make sense? This dose that I'm about to give to my patient, does this really make sense? Okay. Is this what I typically give? And if it's not, why? What's the difference? And just making sure you verify that order. So to recap in today's video, I covered basic dosage formulas, little dimensional analysis, some unit conversions. We talked about some mistakes. We talked about some safety, and we talked about critically thinking before medication administration, because like we said, safe medication administration is both a math skill and a critical thinking skill, which ends up to be a safety skill. Okay. And this is only the foundation. I have several more videos to go, but we're starting from basic to more challenging. Okay. Um, and in the next video, I'm going to build on this. You know, we're going to talk about tablets and capsule dosing calculations. And so if this video helped with just simplifying dosage calculations for you. And I hope that as I was doing it, you were actually writing it out, putting, what was ordered in the numerator, what was available in the denominator, and then multiplying that by what you were looking for. Hopefully, that basic simplified dosage calculations was very helpful for you. Um, Please make sure that you subscribe to Nurse Ed Scholar so you can get more of this series to help you with dosage calculations, because I'm really trying to build your confidence step by step, from beginner to advanced medication uh, calculator, I guess. We calculation medicines. We'll start from beginning. We're going to start some more advanced. And please, tell me what part of dosage calculations kind of confuse you. What really confuses you the most? Okay. And put that in the comments. And so I can respond back to you and try to help you some more. Um, and understanding dosage calculations. And so I'll see you in the next lesson, and happy studying from Nurse Ed Scholar.